Sheni Ravji-Smith. Okay?
Okay, morning everyone. I'm mindful that I'm standing between you and your coffee now, so no pressure on me, hey? Okay. So, for those of you who don't know me, I'll recognise a few faces. My name's Sheni Ravji-Smith. I am from the Health and Social Care Partnership, and I'm the OD Leadership and Wellbeing Lead for Greater Manchester. So I work alongside a number of different colleagues and groups across Greater Manchester, especially over the last 18 months or so. So I'm here to share some of the work that we've been up to. Hopefully there'll be things that are going to be practical to help you, help your teams, and introduce some resources. Everything that I share with you today, you're going to get in the slide deck. There's lots and lots of hyperlinks in there, so you can click through at your own leisure when you get those slides, so you don't have to make a note of anything. So let's make sure this works. Okay, hopefully you can all see that. So we're all really busy we're all really busy with delivering the services that we're delivering. We've got demand that's going up, we've got guidance that's changing, we've got a media that perhaps can be a little bit unkind, let's face it, and it kind of layers on us on a day-to-day basis. So one of the things I really like to start doing is by starting off by asking, where are you today? Do we ask ourselves this? When we get ready in the morning, we brush our teeth, we comb our hair, we do whatever we do. Do we ask ourselves and check in with ourselves and ask, where are we today? It's really, really important. So, I love this. This is called the Blob Tree. It's by a chap called Pip Wilson. You can download it. There's a link on the slides. Do have a look at it because it helps you really understand where you are on a day-to-day basis. Now, some days when my technology is really rubbish and I can't get hold of the servers, I'm kind of that person, that blob right at the bottom, the number 5, feeling completely defeated, have exhausted all the options that I can exhaust, and I'm just feeling like I can't do anything. Other days, I'm right at the top of that tree. And so what I'm paying attention to is when I'm feeling awful or when I'm feeling unempowered, how does that then present itself to other people? What shifts in my language? What shifts in my behaviour? Do I smile as much? Am I as open to conversation? And therefore, if I start thinking about how I'm feeling, I can then think about how other people might be feeling as well. And so when you're working in your teams, when you're working in your squads, in the way that you do, wherever you work, whichever setting you work in your surgeries, across, whatever that setting might be, it's really important to kind of understand those small team dynamics can really have an impact. So I would encourage you all to download Pip Wilson's Blob Tree, have a look at it, get it into your practice on a day-to-day basis, but also use it with your colleagues as well. I never start a one-to-one conversation without using something, either this or something similar to this. So it's a really powerful tool, so do have a look at it. So when we first started doing this work, we had quite a low-level approach to workforce well-being. You know, we kind of did it as a very responsive thing. If somebody got poorly, we sent them to EAP or we referred them to occupational health. What we haven't necessarily done over the years is actually really look at the preventative side of things. And so over the last 18 months, we've actually we are trying to shift some of the cultures around how we approach well-being. And when we started to look at all the different definitions that were out there, because let's face it, there was a bit of a tsunami of resource and support and things that were out there to support us as a workforce. So it became really difficult to start navigating through some of this. We found that some of the descriptors around this were really quite complex. So we wanted to keep it dead simple, because guess what? None of us have got the bandwidth to take more and more stuff on. So we want to keep this really practical and really approachable. So we think good well-being is when we're able to be at our best. That's it. It's as simple as that. It's different things for different people, but it's about what helps us be at our optimal best. And we've decided from having conversations with lots and lots of people that we think that there are 3 areas that we need to pay attention to in terms of our well-being. The first one is the psychological, and we'll talk a little bit about that. So what our mental well-being looks like, what our moods look like. The second is the practical, and that might be everything from the frustration of not being able to find parking, or having running bike schemes to support people being able to get to and from work, or during lockdown actually being able to jump the queue in the supermarket so we don't have to do a 12-hour shift and then still have to queue up for the pasta that we're not going to get. So that's referring to last year, it might actually refer to now as well, who knows. And then the third area is that physical. And the previous speaker, sorry, I think it was Chris maybe, sorry I didn't catch your name, apologies, was talking about the importance of that physical aspect. Building in a daily mile walk, whatever it might be, cycling to work, doing regular exercise, having an impact on our physical but also our psychological mood, really, really important. So the Greater Manchester Wellbeing Toolkit, which you've got links and hopefully you've all seen in some shape or form already, is broken down into those sections. And we've approached it from what helps you as an individual, what might help you support your teams, and then all the resources that we think are out there across Greater Manchester that are open to everyone, regardless of who your employer is. And the reason I mention that is one of the big things that we found is, especially when we've got multidisciplinary teams, that we had some members of a team, because they had, NHSEI as their employer, they were able to access a whole host of stuff. And then there were other people who were employed by an agency or employed by a third party who weren't able to access that because their employer didn't do that. So we wanted to make sure that we had equity. And we've also challenged as well along the way. So every single bit of resource that you see in the toolkit is open to everyone who works across our health and care workforce. So it's really important. And just very quickly, you don't need to be told this, you know this already. There are some really key drivers why we're doing this work. I've mentioned the culture change to that preventative approach that we're really trying to put into place. COVID has been that catalyst to make this happen. If we're talking about potential silver linings in all of this, it's that it's paid attention to what our workforce wellbeing looks like, the workloads that we're dealing with, the pressures that we have on a day-to-day basis, and the things that we can do to help shift some of this. So we're looking at that, everything from the way that technology is being embedded, how the appointment systems work, how we access information, all sorts of different things. So we're looking at that. We're looking at the equity side of things, which I've mentioned. But we're also aligning it alongside, we've got a national NHS people plan, and that's been translated into a Greater Manchester people plan. So as we move into our integrated services, we're aligning with all of that. In fact, we're influencing all of that in terms of some of the approaches that are being taken. So we've got that as a bit of a background. We also know that we've got sickness rates. We've got trends around some of that, so we know that mental health in any shape or form is one of the top reasons that people give for sickness absence at the moment. We also know that MSK is there as well. So we've got lots of really key trends that we're doing some work around. We know that, I'm not even going to ask, who's feeling a little bit tired and a bit fatigued and burned out, because we all are. We've been working in a really sustained way. And hopefully you've all had a chance to have a bit of a break over the last 6 months or so, but if you haven't, please do take that break, because we know that there are still colleagues who are just carrying on and carrying on and carrying on, and we don't want to get to the point of a crisis where you as an individual can no longer participate in your work life. So we want to support that. We know that there's a challenge around how we attract new colleagues, but also how we retain our colleagues. There are a number of people who are making different life choices for themselves as individuals, but overall it does have an impact on all of us. And we've still got a really long journey ahead of us, and we need to pay attention to that. So when I'm sat in rooms and people are talking about recovery plans and all sorts of things, I constantly remind folk that actually we're still in the middle of a response. We're not quite at that point of recovery. We can start thinking about it, we can start planning it, but we're not quite there as a whole workforce. So we do need to pay attention to that. I like to think that good work days look like, right, there we go, so you're right, there we go. Calm seas, all those containers are in order, it feels like you're in control and you're having a good day. The majority of us are feeling like that container on the left. It's cloudy, it's stormy, we can't see the end point, everything's stacked on top of each other really precariously, and we're just about making it happen on a day-to-day basis. And I quite like this analogy, because actually when I do this, I'm still seeing lots and lots of nods in the room. So we might not articulate this on a day-to-day basis, but hopefully we're all aiming for the calm waters. But sometimes we do have those days, and we do need to pay attention to that. Okay, so most of you will be part of a team. Some of you will be managing a team. So it's really important not only that you look after yourself, but also you pay attention to how you can get the best out of the people around you as well. So we've got some pretty basic but really important reminders of what it means to take care of your teams and yourself as well. So be kind to yourself. We're all very used to being providers, deliverers, service providers. We look after others on a very regular basis, and we put pressures on ourselves in terms of the volumes of things that we can do. So think about where you can just let that go a little bit and go, actually, we can't do that today. We can do that next week. We can have that conversation another day. So think about some of that. Proactively manage your day-to-day stress and anxiety. So I keep talking about everyone should have an individual wellbeing strategy. And if you're doing line management meetings and you're having a conversation with somebody around their PDR, you should be having a conversation about how are they managing their stress and anxiety. And in the toolkit itself, there is a template that you can use in terms of some of the questions that you can ask. Because one of the things that we found was that people line managers came back and said, we want to have a conversation. Actually, we don't want to say the wrong thing. We don't know how to start that discussion. We can talk about performance really easily. We can talk about future plan really easily. But we don't always kind of step into that space where we talk about individuals. So encourage everyone to have a good wellbeing strategy. So it might be something like, actually somebody's going to the gym 3 times a week, or they're deciding to walk to work or get off the bus a little bit earlier. So there's some of the physical aspects. People might actually decide that they're going to switch their phones off in the evening or not participate in social media conversations. That's part of your wellbeing strategy. There's all sorts of really practical things. And it's going to be different for everyone. So have that conversation. And the one thing that I will say is listen to what's being said to you. So if you ask the question, just listen, and the answers will be there of how you can support somebody. Socially distance, I think we're still doing that, but don't isolate yourself. I think that's still really, really relevant. We're so used to kind of getting on with things that we're not actually perhaps connecting with each other in a way that's as meaningful and as relevant and supportive as we need. Because we're all kind of meant to be okay with this now, aren't we? But actually some of us aren't okay. I've journeyed in, took me an hour instead of about 20 minutes to get here. So I had the anxiety of the fact that I might be late, but I wasn't, great. But I was really mindful that there were lots of people who weren't socially distancing around me, people who weren't wearing masks. And actually, I find that a little bit uncomfortable, to be honest. And I know that people don't necessarily say that. It might even be an unpopular thought, but you might have members of staff who are feeling like that. So ask those questions and have a good sense of how people are feeling at the moment as all of that societal kind of shift is moving. Keep calm, don't always carry on. I mentioned it earlier on, don't get to the point of crisis. Ask for help, be preventative about that, look at your wellbeing strategy, and don't wait until you're absolutely keeling over or you can see somebody else completely getting to a point where they can't participate in their work life or their home lives either. And keep looking up. This will end at some point, and we will get to a point where you will start seeing the end of the tunnel. And it definitely isn't going to be the same as it was before. It will be different, but we can hopefully start projecting to what that future looks like. Okay, I'm going to start moving through a little bit quicker. So this is one of the slides that I mentioned. There's lots of hyperlinks. So each one of those is tagged, so you can kind of scroll over it and click on it. It'll take you directly to the resource. So we have the Wellbeing Toolkit, but within the toolkit, there are also lots of other resources that are embedded in there. So you should be able to just click through. What we've tried to do is keep it as accessible as possible, as relevant as possible. We haven't produced reams and reams of policies and procedures and all sorts of things, because this is meant to not feel like work, to be honest. So we've got some guides. They're based on good practice. We've talked to lots of other people. We've collated it all together, and we encourage you to embed them into whatever practice you have in your work setting. So some of you might already have some of this in place. That's brilliant. Look at where you might be able to enhance it. And if you haven't got anything, then wholesale, just pick some of it up, and at least you've got a starting point. Now, we're not suggesting that all of this is absolutely correct for everyone out there, but it's hopefully going to start those conversations about what you might need in your setting. So you can see here, for example, we've got a guide to improving sleep, breathing to help stress, a really important basic thing. Thinking about menopause, there is a whole series of work around menopause coming for the workforce over the next 6 months or so. So look out for some of the links that are coming through that. Finding your motivation. So I talked about earlier on people making different decisions about what they want to do with their work lives or their home lives. There's a really great tool. It's based on Japanese life theory called Ikigai. Do have a look at it. It's a great way, especially if you're a line manager, to have a conversation with somebody about what's motivating them, what's driving them at the moment, and helping them find that balance. Can't always answer all those questions, but at least you can have the conversation and have a level of awareness. We've got dealing with anxiety, so there's a really great exercise there to talk about control and how you can help and support somebody whose anxiety levels might be a little bit higher than normal, and eating for well-being. I'm not going to talk about that one. But the one I really did want to highlight is the Buddy Guide. We developed it when I was part of the setup team at the Nightingale Hospital last year, and we had a workforce that came from everywhere, and one of the biggest things that we had to do, one of our biggest challenges, was to create a sense of team from people, clinicians who came from different places, who had different practices, different levels of experience. So we had F2 students all the way through to people who are at the end of their career or had returned from retirement. And we needed to find a way that we can support them to team. And the buddy guide is a really way to do that, a really great way to do that. And I've put the word tag there because actually I'm kind of getting feedback that from a lot of primary care settings, people are using it as a tag system. So you identify a buddy in whichever workplace you're in. So it might be in the same team, it might be a different team in the same workplace. And you just check in with each other on a regular basis. You've got somebody who's looking out for your back. So when we had lots of IPC rules that came out, people were wearing whatever they were wearing in terms of their protection, and we had a tag team system where people would check other people's masks or where their gowns were and all sorts of different things. But we don't necessarily do that for our own well-being. So this is to encourage people to think about what that buddy guide might look like. There are some really clear do's and don'ts. So your buddy isn't your therapist, your buddy isn't your counsellor, your buddy isn't the person that's going to fix something, but your buddy is somebody who has a listening ear for you, who's going to look out for you, who's going to check whether you've had a break, who's going to check that you're okay on a day-to-day basis. So do try that out, and if it works, let me know. If it doesn't work, let me know, because we're evolving all of these resources as time goes on. And I've talked about stress and anxiety quite a lot, and hopefully all of you are familiar with the stress bucket. I think it's really important to kind of keep talking about our stress bucket, because that tap at the top is the tap that we don't have any control over. It's the changes in policy and procedure, it's the workloads that are coming down, it's the patient demand that's coming towards us, it's the fact that we've got kids at home who may or may not be able to go to school, it's the fact that we haven't actually renewed our insurance, and do you know what, it's only 3 clicks away, but it's just that one extra job that we can't quite do at the end of the day after we've had a hard day. Can't do anything about that, but what we can do is pay attention to that tap at the bottom, and that's what our resilience is. So when we talk about developing that wellbeing strategy is about when we turn that tap on at the bottom and help that whatever's coming towards us flow through. So it doesn't gather in that bucket and it doesn't overflow to the point where you just feel overwhelmed with all of it. Now again, for each of us, that bucket's going to look really, really different. It depends on our home circumstances, our life circumstances, the way that we've been brought up, the way that we approach our well-being, whether it be physical or psychological. But we can pay attention to it, and by paying attention to it, we can become really conscious about what's working for us and what isn't working for us. And none of that, and I have to emphasise this, is a fixed point. So if you were running 3 10K runs when you were in your 20s, that might not necessarily work if you're in your 50s. You might have to make some adjustments to something. Or it might be that you actually need to do something a little bit more meditative. Or you might decide to use, some other form of physical activity. So really do reassess it on a regular basis and have a look at what's working for you. Because all of this is about how we're at our best. So if you go back to Pip Wilson's blob tree right at the beginning, what does a good day look like? And what does a not so good day look like? If good well-being is about being at our best, if we don't pay attention to what makes us feel our best, how we can think our best, our cognitive frame that we approach our day on a day-to-day basis, then we're not going to be doing ourselves the best service. So as much as we're busy looking after other people, we also absolutely, optimally have to look after ourselves. And it's really easy to say that, and you're all going to be sat there going, I know this already. But it's surprising how many people don't pay attention to this or dismiss it and go, actually, I'm not feeling that bad. I won't pay attention to it right now because there's other people around me that need it more than I do. If you don't put yourself first, then you're not going to be able to support and help other people. And I would encourage all of you just to reflect a little bit on that. Okay. So, I've talked about you a lot. Your workplaces are probably the one place that you're spending more time than your bed. You go home, you do other things, but you spend a lot of time in bed. Hopefully you're getting enough sleep. But in terms of a waking day, you're spending a lot of time in your workplace. So your colleagues are your family. They're the people you probably spend more time with than your partners, your children, your flatmates. So actually, why wouldn't we want our workplaces to be the most optimal, best place to support what good looks like and what a good day looks like? So some of that preventative work that we're doing is about how we shift our working cultures and how we create a really positive approach to what good work cultures look like from a wellbeing perspective. This isn't a really simple thing. I mentioned earlier on, previously we had a very reactive approach to what well-being might have been. So something went wrong, we sent people to occupational health, or we referred people somewhere else. We have a culture and a legacy of not doing things in a proactive way when it comes to well-being. So we have to be very conscious about it until it becomes day-to-day practice. So that evolution of that well-being in our workplace is this is why we've taken a really practical approach. So if you go back to the 3 things that I mentioned earlier on, the physical, the psychological, and the practical, if you look at the really easy kind of day-to-day things that you can just start shifting in those 3 areas, you are well on your way to shifting some of those work cultures. And if you can then pay attention to how you support other people that work within that work family around you on a day-to-day basis, you'll get to a point where you'll slowly just start seeing those shifts. Sounds simple, doesn't it? It's really hard to do, but it is quite simple. So just need to pay attention, just need to listen, and just need to be very conscious about what you're putting into that workplace. And please remember that everyone needs something different. There is absolutely no one-size-fits-all with all of this. So remember to try and be as diverse in the offers and the support that you put into place, as inclusive as you can. So if there's something that you're doing that doesn't include the majority of people, then perhaps you need to think about another way that you can include those that perhaps are a little bit further on the sidelines. Okay. So this is pretty much more of the same, just talking about kind of keeping things simple, keeping things clear, thinking about those 3 aspects, the physical, the practical, and the psychological, and I keep coming back to that on a regular basis, and design it in a way that actually supports people to grow, and you embed it in everything. So if you're doing your PDRs with your staff, it's embedded in your PDRs. If you've got a clinical handover that's happening at the beginning, at the end of a shift, then you include a wellbeing aspect of that. And I'll come to a little tool that we've been using across some of our primary care, our care homes, and also our trust settings as well, which is really useful for that. And we know that as managers, it's also really difficult because we have to really think about how we approach having good conversations. I mentioned earlier on, one of the big bits of feedback that I've been getting as a team is that people kind of want to ask these things, but they don't know what those questions are. So alongside the Wellbeing Toolkit, we also have a good conversations guide for managers as well. Some really good practical stuff. So if you're getting to that point where you're doing your appraisals, you're having day-to-day conversations, or you're doing those regular check-ins that hopefully you are doing with your staff, with your teams, then have a look at this, because there might be some things in there that will help you. And again, there are links in the guidance there, and there's some of the snapshots there in terms of what that cycle might look like and how you can have those conversations to set some of those priorities. I mentioned the tool about that debriefing. So this check-in, check-out is a really important way of doing that. It's very, very practical. You can do it on a day-to-day basis, and it's just a series of questions and queries that you can set for yourself, but also do with your colleagues around you. And the really important one that I want to kind of draw your attention to is choose an action that signifies the end of your working day. So that might be you slam your locker shut. That might be you get into the car and you put a particular piece of music on. That might be, if you're working from home, that you actually shut your laptop, do something, shut that door wherever you're working in the home setting, but you psychologically close your working day off. Because technology means that we're whirring all the time. My phone's buzzing, I can hear emails pinging in, and it's really hard to stop. Or we've got workload that we're just going, I'll just do another half an hour, and before you know it, you've been sat there for 2 hours doing some more work. And the reason that that's really important is, and we know this because evidence has shown us from previous kind of activities, that actually that workload, psychologically as well as physically, is bleeding into our home lives, which means that ultimately it'll impact on our relationships with our partners, our flatmates, our children, and that quality of relationship as well. So what we don't want to do is get to the point where it's also impacting on those home relationships. So do pay attention to how you actually close that working day off. When to ask for help. I do this at every session that I run, and I'm probably running a few of these every single week at the moment. And it's really important that we pay attention to when we should be asking for help. So we've talked about a lot of the preventative stuff. If you or those around you are experiencing some form of distress, then you might need to ask for help. If you're not able to focus at home or at work in ways that you had done previously, but you're just struggling a little bit, then you might need to ask for help. If you've had poor sleep over a long period of time, and we've all got poor sleep in some shape or form, I'm sure, but if it's constant, then please ask for help, because that's not going to put you in good stead. If you've significantly either increased or changed your intake of any form of substances, and I've got a really broad definition of substances, so I do include alcohol, drugs, all sorts of different things, but I also include exercise in there as well, because actually we have got some people who are exercising so much because they use it for their mental well-being, that actually it's having an adverse impact on their joints, so then having to find a great physio out there, or what have you. So just pay attention and find that balance. You might need to pay attention to that. If those people around you that know you really well are saying, are you all right? I'm just noticing there's a little bit of a shift. I'm a bit worried about you. Don't dismiss it. You might not want to have that conversation at that point, but do pay attention to why somebody who knows you really well has just noticed that shift, because they're more likely to notice it before you are, and pay attention to it. So please ask for help if you get to that point. And you'll know in yourself if you're worried about keeping yourself safe. So last week was Suicide Prevention Day on Friday. We've got Suicide Prevention Month this month. It's really important that we do talk about the whole spectrum of where people might be. And suicide prevention is really important. There's a bit of training that's in the toolkit. We're encouraging everyone to do it. It's 20 minutes. So if you've got teams, please ask them to do that bit of training, because it's about building awareness, not only for yourselves, not just for your teams, but also for the patients that you look after as well. But we want to keep people in the middle of that spectrum. So if you imagine kind of super wellness over here, and then somebody who might have suicide ideation at this end, we want to help people kind of stay in that middle. Sometimes have a good day, sometimes have a bad day. And hopefully people don't get to that end of the scale. So do pay attention to some of those and ask for help when you need it. We have a resilience hub in Greater Manchester, and it's really interesting kind of when people think about who the resilience hub are. They are a commissioned service by Greater Manchester for you as our workforce. You can tell your employer that you are accessing them, or you can be incredibly discreet about it. You don't need a referral. So some people might prefer to go through their employer for support. Other people might want to be a little bit more discreet. And we know that there are some trends from certain kind of work groups of people who might not necessarily want to share with others that they might be struggling, but might need something else. So please do contact the Resilience Hub. They're there for us, and they're there to be used. And what they'll do is they'll help triage, they'll do an initial assessment, and they'll help triage you to the right support. And it'll all be discreet, and it doesn't cost anything, and you can do it with complete discretion. There's lots and lots of services there, and I've put the links in there as well, so when you get the slides, you'll be able to kind of look through that. I've also included a couple of slides in here. So all of this is in the toolkit itself, but I pulled this out. So this is particularly kind of for primary care. So there are some national offers from our national colleagues. So it's called Looking After Yourself Too. There's lots of support offers, but there's also coaching offers there as well. So I know that we've had a decent uptake from Greater Manchester. I don't know who's doing it, but I certainly know some of the figures as well. So do have a look at that. I've mentioned the Resilience Hub. We're really lucky in Greater Manchester. We have Greater Sport and GM Moving, and if you haven't kind of come across some of the work that they're doing, when we're talking about physical well-being, not only for encouraging patients but also ourselves, they're doing some absolutely brilliant work. And I was attending their conference yesterday. They've got a new strategy. It's brilliant. Do have a look at it, and the link is there. They've got an active workplace toolkit. We've also got a mental health toolkit that's been produced by PHE in partnership with the Good Employment Charter. So again, another Greater Manchester initiative to really look at what good work looks like. So have a look at that. And we've got some emerging work about what good leadership behaviours look like around wellbeing as well. So what are those competencies? How do we know what good looks like? So when we talk about the cultures, how do we encourage all of us as leaders, big L's and small L's, across our organisations to demonstrate those behaviours that basically show what good looks like? So there's the Healthier Leadership Framework, and of course, I'll keep talking about it because it's the work that we've been doing, the Greater Manchester Wellbeing Toolkit, so do have a look at that, and that link's there. But we also might need some really practical advice. So we've got links to the Money Advice Service that will continue to be there free of charge. They're doing some great work. We know that financial well-being is just as important as anything else. So that might be as a result of you've just had a change in your circumstances at home. So either yourself or your partner's had a dip in kind of income, and that's having an impact on your overall household, or because of some form of illness, you're not able to work in the way that you have done previously, and that's having an impact. So that money advice service is really, really important to do have a look at that. Some of you might want to access either groups in your community or faith groups, or groups that kind of reflect the lifestyles that you have. So we've got a number of other links to kind of 10GM, GMCVO, our interfaith network, who have chaplains who have been primarily working in our trusts and our acute settings, but actually are doing more and more work in community settings as well. And it kind of makes sense to make sure that you guys know that that's available, because it is there and it is available. And then we're also doing some really brilliant work with the LGBT Foundation, particularly around the intersectionality of what wellbeing looks like. So we think about people with their single characteristics, so, you know, middle-aged female, but we might not think about she's also might be from the LGBT community, or she might have a faith group, or whatever that might be. So do have a look at some of that provision as well. So I'm going to finish on a call to action. I'm never going to walk into a room like this and not ask you to do something. So my call to action to you is to think about, are you clear about what you're wanting to shift and change in your workplace? What do you need and what have you already got? The amount of times where I go in and support either a practice, a general practice kind of setting or what have you, I go, what have you already got? And they've not necessarily paid attention to what's already around them because they've not paid attention to it. So think about what you've already got and think about what you need and where your gaps are. How are you having conversations with your colleagues around you to do this collectively? Because you individually don't own this. It has to be a collective approach to really make an impact. And remember to look after yourself in this. None of this stuff should be hard. It should be simple. It shouldn't feel like work. And with small incremental kind of shifts, you should hopefully be able to make some big changes. And I'll leave it on that. I'm going to stick around, so if anyone wants to have a conversation, please give me a shout. And hopefully you'll all be in a better wellbeing place. Thank you.